Hi friends, today let's talk about spondylitis, may it be cervical or lumbar, because I've seen lately a lot of rise in cervical patients and lumbar patients coming to me. Now, what is spondylitis? Some people call it cervical arthritis, some people call it spinal arthritis, and some people call it the osteoarthritis of the spine. So whichever which way, let's call it cervical spondylitis or lumbar spondylitis, depending on the location. Cervical would be the neck region and the lumbar would be the lower back region. Now, what is spondylitis? Spondylitis is basically between two vertebrae in the spine. The disc that is in between would get desiccated, the moisture content would go, or it would herniate. Herniate would be movement of the disc in the front or behind. Now, why does that happen? Desiccation, of course, happens because of age, and generally we see beyond the age of 60, the discs would start dehydrating, and therefore cervical or lumbar spondylitis symptoms would occur. But the herniation would happen either because of some injury or because of the wrong postures. Now, lately, we see a lot of rise in cervical and lumbar spondylitis, which is not age-related, which we see in the younger generation. Why is that? You got it. It's the wrong posture. We see that a lot of younger generation want to watch a complete film on their small screens like mobiles or iPads. So they would always be looking down for a long time, for about 2 to 3 hours. So what happens is when you're looking down, your the vertebrae would turn down. With the result, the disc in between would try and herniate it to the front. Now, when that herniation would happen, the nerves that are coming out from in between the vertebrae would start getting compressed. Now, when that gets compressed, how does it show you? What are the symptoms that come out? The kind of tingling, a kind of numbness that you would feel in the hands is because of the cervical, or in the feet, that would be because of the lumbar spondylitis. Lumbar spondylitis patients may also feel like a kind of bladder weakness, bladder control is lost. The cervical spondylitis, if it's the upper cervical, the nerves going up may also, if they get compressed, may also cause vertigo. Also, there would be a kind of occipital headache, that is the headache behind in this area, or a kind of neck area where there would be a stiffness or a kind of pain. So what do we do to avoid this? Best, of course, is posture. There is no two questions about it. We just have to improve our posture. Younger generation, please make sure you don't slouch when you watch your TVs on the screen. Please make sure that your back is erect. Make sure you're not watching too much of small screen stuff. Make sure you're not WhatsApping for a long time. Make sure it's just the important things that you're doing, and then get back your head erect, or make sure that your mobiles are up in your eye position, in eye level, so that you don't slouch, so that your neck does not come down. Of course, physiotherapy, when you're in pain, the physiotherapist may give you traction, or maybe give you an ultrasound, whatever. She or he would be the right judge. Then, of course, a neck collar, which you can get in the market. If it's too much for cervical, you can wear that, so that the neck, when you wear that collar, the neck does not bend. So automatically, it is that your neck would always be high, your head would be high. Also, of course, if there's an injury, then you need to see the doctor, and some kind of B12 supplements would also help. But homeopathy has an answer to all these symptoms, to spondylitis in general. So we make sure not only does the tingling go and the numbness go and the pain get better, but we also make sure that the nerves create their own path, and therefore they are not compressed. Another word of caution would be that don't wear too much of heavy coats, especially because the winters are around here. So I see a lot of youngsters wearing a lot of heavy coats when they're in complete pain. That again, because these muscles need to relax, and the heavy coats will make sure that the muscles are contracted. So try wearing a lot of layers instead of one heavy coat. And homeopathy will definitely give you an answer to cervical spondylitis.